All right, we ready? All right, good morning, everyone.
Good morning.
And thank you so much for being here. We are here to give you an update on where we are as a city regarding COVID-19 and to put some recent news into context. Let me begin by recognizing other people who are joining me here today. Of course, Chicago Department of Public Health Commissioner Dr. Allison Arwady, Chicago Department of Public Health Medical Director Dr. Geraldine Luna, Howard Brown Health Regional Medical Director Dr. Meyer Green, and Social Works Street Team Supervisor Kevin Young, who overcame his hesitancy and chose to receive a life-saving COVID-19 vaccine. Now I'm going to turn it over to Dr. Arwady to dig into some of the details and put some of the recent news in context. Then you will hear from Dr. Luna, Dr. Green, and Mr. Young, and then I'll come back at the end before we have questions. Dr. Arwady, I'll turn it over to you.
Thank you, Mayor. We will be posting these slides online right after the press conference so people are able to take a look for themselves at the data. So as you know, on Friday, the City of Chicago passed our 200 case per day mark, and in line with CDC guidance and CDPH guidance, we have recommended that all city residents and anybody in Chicago over the age of 2 should be wearing a mask regardless of their vaccination status. However, there has been a lot of worry related to breakthrough infections, and I wanted to really make sure folks had a good understanding of the risk and, importantly, how well the vaccines continue to work. So first of all, here's where we are on our Chicago community transmission matrix. I want to highlight we've made one change and one change only, which was to rename the central column, which we'd been calling moderate transmission. We're calling it substantial transmission because that's what the CDC calls it. But we have not had a single change to these cutoffs or to these numbers. We've been using them all along. So what we see is that here in Chicago, we're now averaging 206 new cases every day. And with that, crossing the 200 threshold, we move from the lower transmission to the substantial transmission. Our other metrics remain in the lower transmission category. Our positivity is currently 3.1%. We have approximately 121 people hospitalized across the city with COVID, not in the ICU, and another 42 in the ICU. Where we put these numbers into perspective, we have been enjoying well-controlled COVID over these last 2 months, especially because we have a lot of folks vaccinated. There were only 13 days in all of 2020, and that was in early June, when we had fewer than 200 cases per day. So it is not in and of itself that concerning that we've crossed the 200 mark. Certainly, we want to take care of each other. We want to help protect people like children who have not yet had the opportunity to be vaccinated, or older adults, or those who are immunocompromised and maybe at higher risk. But I want to remind you that we are not surging in a way similar to what we had seen in the first or second surge. And I expect we may see a surge. I expect we will see a surge, but it may be more like what we saw in our third mini surge in April, where most of those cases were in people who were unvaccinated. I also want to say very strongly that I know you may be hearing stories about people who have been fully vaccinated and have gotten COVID-19. That's called a breakthrough infection. It definitely happens because there is no such thing as a completely protective vaccine. But here in Chicago and across the country, 99.9% of vaccinated Chicagoans have not been diagnosed with COVID-19 since being vaccinated. 99.9% have not been diagnosed with COVID, and that holds nationally as well. Where we look at hospitalizations, again for some context, we're currently averaging between 8 and 9 new hospitalizations a day. And again, if you look over the whole pandemic, on the left side here, that's right at the beginning, where we were having as many as 150 people being admitted every single day to the hospital. The worst that we had, and by far the point where our health system was the most threatened. In the second surge, in November, December, January, as vaccines started started to come into the picture. You can see what the hospitalizations look like there. But then again, in comparison, in this April-May timeframe, we saw a surge, but because of the vaccine, did not have that same risk of overwhelming the health system. Since January 2021, 97% of COVID-19 hospitalizations in Chicago residents have been in people who are not fully vaccinated. And again, for breakthroughs, 99.99% of vaccinated Chicagoans have not been hospitalized with COVID-19. And then finally, related to deaths, again, if we look across the whole pandemic, since January 2021, 97% of our COVID deaths in Chicago residents have been in people not fully vaccinated, and 99.999% of vaccinated Chicagoans have not died of COVID-19 since being vaccinated. And again, I want to highlight where we look at the surges here of deaths. During that first surge, when we had to shut down, where we were really worried about the health system, we were averaging 350 deaths per week, about 50 per day from COVID-19 in Chicago. During that second surge, it was about half that. We were averaging about 180 deaths per week and 25 per day. And through the third surge, I put parentheses because with vaccines available, we did not come close to overwhelming the health system. We were having about 50 deaths per week or 7 per day, and currently we are averaging 1 death per day. So again, numbers are on the rise. Delta is here. It's more than 80% of the cases that we're diagnosing. I expect we'll see some increase, but the vaccines continue to be highly protective, especially against severe illness. Here's just a visual of what this looks like nationally. If the green box here is representing everybody who has been vaccinated, that red box, that small little corner, represents people with symptoms who have had COVID. And then in the red corner, there's this little tiny yellow. That represents the people who have actually died. So this is not common, although it tends to get a lot of attention because it worries folks. And then in Chicago, again, if we just look since March, this is looking at the difference between the risk of COVID-19 diagnosis for people who are unvaccinated, partially vaccinated, or fully vaccinated. That red line shows, again, that surge we saw in March and April, where the cases were falling in people who were unvaccinated. That dotted line is people who were partially vaccinated, so it's essential you get both doses of the vaccine if you've had Moderna or Pfizer. And then that bottom blue line, people who are fully vaccinated. We see the similar pattern if we're looking in folks who are hospitalized. So similarly, the huge majority, you can see that blue line is actually close to 0. Again, we expect it to go up a little bit, but unfortunately, most of the people getting seriously ill with COVID-19, these are vaccine preventable infections. And then finally, here are the deaths, and you see that same pattern. We have administered more than 3 million COVID-19 vaccines just in Chicago. So if you've been waiting to say, I want to see more people get it, or I want to wait longer, the trials of the Pfizer vaccine, the big trials, have also now been going on for more than a year. We have not identified long-term side effects. Sometimes I hear people say still there have been thousands or hundreds of thousands of people who have died from the vaccine. That is just not true. I hear people say there are fertility concerns related to the vaccine. That is not true. I hear people say there are microchips in the vaccine. That is not true. Please, I encourage you, if you have questions, if you're reading things on Facebook, you're hearing from friends, please talk to somebody who has spent some time looking at this. Talk to a doctor, talk to a pharmacist, go to one of the websites for medical providers, or go to the CDC, go to the Chicago Department of Public Health. But please don't just take the word of somebody who might be posting something on Facebook, because there's a lot of misinformation. At least 40% of age-eligible Chicagoans, meaning over the age of 12, in every zip code in Chicago have had at least that first dose of vaccine, which is good. We're just about at 50% of our children in that 12 to 17 range getting the first dose, which we're pleased with. But if we look at the breakdown here, so on the left, every zip code in Chicago is shaded because this represents every zip code every zip code that has at least 40% of the folks vaccinated. As you move to the right, there are 6 zip codes in white on that zip code. You can see on the south side and then the Austin area on the west side. 6 zip codes that are at least 50% vaccinated, which is good, but not 60%. Then as you move to the right, we've got 13 zip codes that are at least 60% all but 13 zip codes are at least 60% vaccinated. Again, predominantly on the south side and on the west side where we're lagging a bit. For some context, I am very happy that most of this map is blue, but it needs to be higher. Where you're seeing major surges, there are many counties and parts of the US where fewer than 20% are vaccinated. It's a very unsafe situation. But particularly in the unshaded zip codes on these maps, on the right sides, those are areas where the risk is higher because there are more people who are still not vaccinated. In contrast, this is where we would like every zip code to be shaded. On the left, the dark blue marks zip codes where at least 70% of age-eligible Chicagoans are vaccinated with a first dose. You can see that's predominantly on the north side, also very nice uptick on the southwest side. The middle represents 80% vaccination. And you can see we don't have a lot of zip codes where at least 80% are vaccinated. And when we get to 90% vaccinated, you see it's just some of these very, very low population zip codes in and around the loop. So we have a long way to go. If the maps on this page were fully shaded in, we would be largely putting COVID behind us. So please, if you've not had the opportunity yet, get your vaccine. They remain available. We've been sharing the same information for months now. Completely free, ZocDoc.com/vaccine or 312-746-4835. Every Chicagoan is eligible for free at-home vaccination. We've expanded that capacity. We've got evening hours now. We can vaccinate up to 10 people at a time. You can choose between Pfizer or Johnson & Johnson. There is no identification required, no insurance required. You will not get a bill. So please call this number, and we'd love to bring vaccine to your house. Couldn't be more convenient, and you're doing your part to protect yourself. I just want to end by saying that in Chicago, we can be open and be careful at the same time. Being careful means getting vaccinated. When you get vaccinated, first and foremost, you are protecting yourself, although there is also some indirect benefit to others. And when our numbers are higher, like they are right now, not crazy high like they were last year, you put on a mask. When you put on a mask, you predominantly are protecting others, although there is also some benefit to yourself. Those two things working together help us be careful as a city and stay open. We have no goal or current plans to close down Chicago again. But we need people, please, once again, to step up. We've made it through this pandemic well so far, especially when you compare what happened right at the beginning to after we were able to get a lot of these mitigations in place. I know it's hard, especially for people who are vaccinated, to feel like they have to put a mask on. It feels like we're taking a step backwards. But when you do that, you help protect people who have not yet been vaccinated. And with some of this data that people can be vaccinated, but still potentially spread COVID, it helps decrease the risk for all. We don't have a way to know by looking at somebody whether or not they're vaccinated. And so it is not forever that we are making this mask recommendation for all. The most important thing, if you're going to choose between a vaccine and a mask, is get vaccinated. But then when you are in indoor public places, we ask you please to put that mask back on. It helps protect you, your family, and all of Chicago. Thank you. I'll bring up Dr. Luna now, who will provide some remarks in Spanish.
Thank you, Dr. Arwady. Thank you, Mayor, for having me here. Ahora les voy a hablar en español las noticias que estamos actualizando. Muy buenos días. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago, y les doy las gracias a todos por estar aquí y a nuestros televidentes y a nuestro público que se conecta. Hoy estamos aquí para compartir actualizaciones sobre el COVID-19, así como también para asegurarnos de que todos tengan la información precisa. En primer lugar, nos preocupan los aumentos del COVID-19 que estamos viendo, la mayoría de los cuales siguen siendo en personas no vacunadas. Todavía tenemos razones para creer que este aumento es causado por la variante Delta del COVID-19, que es altamente contagiosa. Y aunque un informe reciente de la CDC sugiere que esta variante está causando casos de gran avance entre las personas vacunadas, las personas no vacunadas siguen siendo las más afectadas. Y repito, las no vacunadas siguen siendo las personas más afectadas. Los datos hablan por sí mismos. A nivel nacional, al 22 de julio de este año, el 97% de las personas que siguen siendo hospitalizadas con el COVID-19 no están vacunadas. Una cruda realidad que pudiera evitarse por completo. En otras palabras, 99.99% de las personas vacunadas no han necesitado hospitalización por COVID-19. Más aún, 99.999 no han muerto por el COVID-19 de las personas vacunadas. Cuando un virus continúa permaneciendo y persistiendo en el entorno, se producen mutaciones. Esas mutaciones hacen difícil acabar con una pandemia. La herramienta más importante que tenemos en este momento es la vacuna. Sigue siendo su mejor protección contra el COVID-19 o cualquiera de sus variantes. Por lo tanto, si actualmente no está vacunado, lo que significa que no ha recibido ninguna forma de las vacunas, una dosis única de Johnson & Johnson, o ambas dosis, o no han completado ambas dosis de las vacunas Pfizer y Moderna, por favor, se los pedimos encarecidamente. Vacúnese por completo inmediatamente. Puede ir a su centro de atención médica o su farmacia de preferencia. O puede visitarnos a cualquiera de nuestras clínicas de vacunación de la ciudad, visitando chi.gov/, buscador de vacunas en inglés, Vaccine Finders, para encontrar una ubicación alternativa. O programa una cita para vacunarse en la comodidad de su hogar, llamando al 312-746-4835 o visitando chicago.gov/, at home, que significa en casa. Por favor, familia, vacúnese antes que sea demasiado tarde. Y sí, una vez infectado con el COVID-19, no hay marcha atrás. Podría ser para usted demasiado tarde. Como aprenderemos en unos momentos, tanto aquí en Chicago como en todo el país, hemos estado escuchando múltiples historias de trabajadores de la salud que se han visto obligados a contarles a personas no vacunadas y afectadas por el COVID-19 que luchan en una sala de urgencia por mantenerse vivo, que es demasiado tarde para que la vacuna los salve. Estas historias desgarradoras, al igual que la actual propagación de las variantes del COVID-19, son prevenibles. Otra vez repito, se pueden prevenir si solamente tomamos la vacuna. Y queremos hacer todo lo posible ahora para evitar que haya más contagios y muertes, cuando todas se pueden prevenir. Además de vacunarles, quiero recordarles seguir las guías vigentes de la CDC y los mandatos federales de prevención y mitigación contra el COVID-19. En primer lugar, quiero instar a todos a seguir la guía reciente de la CDC de usar máscaras que cubran nariz y boca en los espacios públicos interiores, independientemente del estado de vacunación. Esto es para ayudar a bajar la propagación del coronavirus y, por ende, evitar que siga mutando. En segundo lugar, según los mandatos federales, continúe usando una cubierta facial si se encuentra en un entorno de atención médica o utilizando el transporte público, ya que negarse a hacerlo es una violación a la ley federal y pudiera resultar en sanciones. Sé que mucha de esta información es bien preocupante, pero hemos recorrido un camino increíblemente largo desde donde estábamos en marzo del 2020, una época en que sabíamos muy poco del COVID-19. Pero en cada paso del camino nos unimos más y más y pudimos superar obstáculos que amenazaban con frenarnos y retroceder nuestros avances. Nos cubrimos la cara, nos quedamos en nuestra casa lo más que pudimos, nos hicimos la prueba del COVID-19 con regularidad y ahora cada vez somos más los que estamos vacunados. Como resultado de esos pasos colectivos, nuestros números de COVID disminuyeron, lo que nos permitió comenzar a reabrir completamente nuestra ciudad en la primavera y en el verano, como lo estábamos haciendo. Hemos superado momentos increíblemente difíciles en esta jornada de recuperación del COVID-19. Con tu ayuda y todos poniendo de nuestra parte, podemos poner fin a esta pandemia, superando estos nuevos retos de la misma manera que lo hemos hecho antes. Gracias.
Thank you, Dr. Luna. Thank you to our mayor, to the Chicago Department of Public Health, and our unsung community organizers and advocates that have done so much to bring vaccine and opportunity into communities that need it most. My name is Dr. Maya Green. I'm here to talk more about vaccines and more about the disease. So there are two parts to every disease. In the case of coronavirus, there is the virus itself, and then it's how we're reacting as a human race. Let's be clear, we have to react as one human race. Every day that we fail to do that, we fail together. Every day that we succeed together. That means, I'm gonna take off my mask because I'm having a hard time breathing. That means we have to infuse equity into our efforts and continue to do so. That means me, as a vaccinated person, I don't have time to sit and blame those who have not yet gotten the chance to have vaccinations, whether it's hesitancy, lack of access, or whatever the cause. We know that communities, historically Black and brown communities, and other communities that remain unvaccinated, come into the pandemic with a global historical context that sometimes leads to hesitancy. So today, Black and brown communities, those members of my human race that have been unvaccinated, I speak to you. I speak to you because I know while it may not be easy to make the choice or easy to access vaccinations, it is necessary. So the Chicago Department of Public Health, Protect Chicago, have made efforts to bring vaccinations in our communities, my communities, Black and brown communities. When you see us there, come ask the questions, connect. If you don't trust me, connect with the provider that you trust, the providers that are in your community. Ask the questions that you need and get the answers. But my community, when I challenge you, once you get those answers, step up and get vaccinated. Because for you, you will be 25 times less likely to end up in a hospital or worse if you get coronavirus. You will be more protective of those around you that you love. And then people of my community, I think of my niece and nephew, JL and Caleb. They're not 12, so they can't get the vaccine. Me getting the vaccine protects them. I ask you to step up and get vaccinated for yourself, your community, and globally, because we can't do this without you. Like I said, we must react as one human race. And there are a lot of people saying a lot of things about coronavirus, how it got here. Nevertheless, it's important that we step up, we get the information from a healthcare provider that you trust. Get vaccinated, protect yourself, protect the community. I don't have a lot of time to talk, but if you don't remember anything I'm saying, please get a healthcare provider that you trust. Get vaccinated, get the information. Thank you.
Thank you, Dr.
Good morning, everyone.
Good morning.
My name is Kevin Young. I am a supervisor of a street team, Street Fellows for South Shore Works. And I was hesitant to get the vaccine for one reason. It doesn't cure it, and it doesn't prevent you from getting it. So I did some research. I got the vaccine. I had friends, 5 friends and family members who had got it. 2 of them died, 3 survived. And one of them who survived has asthma, has myself. And she told me, you don't want to deal with coronavirus and asthma at the same time. And the other friend, he had it. He had to be ventilated. He told me the same thing. I went and got the shot. Now, I feel different because I feel like I'm protecting my family and friends now that I've gotten the shot, and my neighborhood. So, to those who feel like they don't want the shot, do your research and get the shot. It helps save lives. Thank you. That's all I have.
Thank you. So thank you, Dr. Arwady, Dr. Luna, Dr. Green, and Mr. Young. Thank you so much for being here today and for your very thoughtful comments. And let me just summarize, I think, what we've heard today and what we want to make sure that we're communicating. Here's the bottom line. We can be open by also being careful. And let me put a more finer point on it. We must be careful to be open. And we can be careful. We're not helpless against the virus or the variant. We, you, and everyone has the tools right now to fight this virus and the variant. The vaccine, the vaccine, the vaccine. That's the tool that we have to help ourselves, to help our family, our community, our city. And it works. It's effective, it's safe, and it will save your life. As Dr. Arwady said, 99% of those vaccinated have not gotten sick. 99%. We can't guarantee 100%. There's no risk-free vaccine. But that is a very powerful data point that we need to make sure that we talk about. And conversely, 97% of the people getting sick now, going into the hospital, and dying are the unvaccinated. When I heard that, it said to me, we have to keep pushing this vaccine to people all across our city. The vaccine remains readily available, it is free, and it is safe. And as you heard from Dr. Green and also heard from Mr. Young, if you are still hesitant, talk to a medical provider that you trust. Unfortunately, there's a ton of misinformation that's out there on the internet, on Facebook, other social media channels. And we're not going to be able to combat that effectively, but you can by getting the real information, the straight dope, if you will, the facts from a trusted medical provider, not from some person who'd post something on Facebook that may or may not be true and in many instances is misleading. I want to especially talk to residents in the 6 zip codes where vaccine uptake remains below the city average. That's 60633 South Deering, 60621 Inglewood, 60649 South Shore, 60620 Auburn Gresham, 60644 Austin, and 60628 Roseland. Those 6 zip codes remain below 50% vaccine uptake. That's a challenge, but also an opportunity. The challenge is you are playing with your life. As we've seen, not only here in Chicago, but across the world and across the country, the Delta variant is real. It is vicious, and it attacks those that are not vaccinated. Don't take that risk when the vaccine is readily available. We will bring the vaccine to your home. All you have to do is call and sign up. We need people in these neighborhoods, South Deering, Inglewood, South Shore, Auburn Gresham, Austin, and Roseland, to get vaccinated. And as Dr. Green urged, if you remain hesitant, if you have concerns about whether or not this is the right decision for you, contact a medical provider that you trust. Get information from somebody who knows, not somebody posting on the internet or social media. These grim statistics, 97% of the people dying in Chicago are unvaccinated, should be a wake-up call for those who are still on the fence and hesitant. This is entirely preventable. We have the tools we need. We are not helpless against the virus or the variant. We need people to step up. We need people to max up and vax up. That's what we need to have happen here today. But stay with us. We are providing information on a daily basis about what the status of things are in Chicago. Dr. Arwady is going back to 2 times a week with her Facebook session. But there's plenty of good information about what's actually happening. And I would also say, members of the media, if you have questions, come to us. We will give you a deep dive briefing. But we need to make sure that actual information, actual facts are getting out to members of the public, not whipped up hysteria. So please, if you have questions, ask us. We'll provide you with the briefing. And ladies and gentlemen of the public, please make sure you continue to do the things that you know work. We're not where we were in March of 2020, and we have a ton of new learning. And we know exactly what we need to do to protect ourselves, and that is wear a mask and get vaccinated. Ladies and gentlemen, with that, I'm happy to take your questions, or any of us can take your questions.
Thanks a lot, Mayor. Appreciate it. Members of the media, you have questions for the mayor. My colleague Ryan Johnson on that side will give you the mic. Let's kick it off with Meyer. Go ahead, Meyer. ABC.
Good morning, Mayor.
Good morning.
Any plans to change this mask recommendation into a mandate, and how satisfied are you with the protocols that have been followed at Lala this weekend and other events to possibly avoid another surge?
All right. So we are encouraging people that are inside to wear masks. That's consistent with the CDC guidance, and we believe that that is the right guidance. We're not at a point yet where we believe that we need to take other steps, but inside, just as you all are here today, mask up. That's critically important. And yes, Lala, 90% of the people that have gone through the gates in Lala are vaccinated. 90%. Dr. already showed the charts about where we want to be. That's where we want to be. 90% of people at Lala have been vaccinated, and hundreds of people who either haven't been vaccinated or haven't shown a negative test within 72 hours have been turned away. Lala, I think, has done an incredible job, certainly working in partnership with the Department of Public Health, but they've taken it seriously, and thousands of young people have been vaccinated because of Lala. We worked in conjunction with them weeks and months ahead to incentivize people to get vaccinated so that they could be and enjoy Lala safely, and we feel very comfortable about that partnership and the protocols that are in place on a daily basis at Lala.
All right.
Other
Aaron
questions?
from the Hyde Park Herald.
Thank you. 2 for Dr. Arwady, please. They're long, bear with me. Given that some fully vaccinated people can carry the Delta variant in their noses and mouths, shedding as much of it in some cases as unvaccinated people, should even vaccinated people be avoiding places where masks cannot or are not worn, like bars, restaurants, and probably nightclubs? I want to say on background that the Israeli Ministry of Health has found that 2-shot vaccine immunity is now 64% against infection and symptomatic illness of the Delta variant, and a study of breakthrough infections involving Israeli healthcare professionals found that 19% develops long COVID.
So, lots in that question. Basically, where we are is that we know and have known the whole time that the vaccine is not 100% protective. It remains highly protective. Certainly, we're following that Israeli data. We're also following the data from 15 other countries around the world that have been doing this well. In the UK in particular is where I think we've been focusing a lot, because they were one of the first settings that has very good testing in place to really see Delta come in and take over. We saw Delta really tear through India, but it was hard to get some assessments there because they just don't have as much of the medical infrastructure to really understand it. And what we saw in the UK was certainly a big increase in cases, very, very big. However, the comparable increase in hospitalizations and in deaths was much, much lower. And that was with the Delta variant in place. The recommendation for the masks is partly because we know that it's possible for people who get infected with COVID, even if they've been vaccinated, it's certainly possible to spread it. We are still learning, though. I want to be clear. This Provincetown outbreak got a lot of attention, rightly, and it got studied. But where we look at Provincetown, one of the reasons it got attention was that it was in a setting where a lot of people were vaccinated. There were hundreds of cases associated with it, fewer than 10 hospitalizations, 0 deaths, and the case rate is back down to basically where it was. And where we think about risk benefit and the potential for sort of opening, closing, and wanting to make sure we can help protect people while still remaining open. The masks are the most important thing. Really, at this point, I have to make the recommendations for the whole population, and different people will have different decisions around other indoor activities. For me, I remain very comfortable in indoor settings. I'm putting my mask on. I was at dinner last night. I took my mask off, when I was eating, just like I did all of last year. And I hope, we got really pretty used to wearing these masks. It's not forever, but it's while we get through this Delta surge. And so I think if there are people who perhaps have someone who is not able to be vaccinated or who is immunocompromised and they're particularly concerned, they may want to be more outside right now. But the most important thing really is to get vaccinated, and then secondly, asking everybody to wear a mask.
And secondly, where do the projections for the trajectory of this surge go as far as where they're coming from? You say that it will be similar to the Alpha variant-driven surge in Chicago, but the Delta is orders of magnitude worse. How does the surge affect the Protect Chicago outreach efforts, which are only in 13 community areas at this point on the ground? And I'm also curious about where the rollout of the city worker mandates is at this point. Time seems to be of the important, given how bad it's spreading. And
What was your last question?
the mandates, when are they going to be rolled out?
So, okay, lots of questions in there too. So first of all,
Aaron violates the three-question rule.
so you were asking about mandates, you were asking about
And outreach efforts.
outreach efforts, and those are the two. Okay. So first, related to outreach efforts, we continue to do outreach absolutely all over the city. As you saw, there are, really just a couple of zip codes in the loop that are 90% vaccinated. So although the most intensive efforts have been in the 13 communities where we remain, less than 60% vaccinated, and, you heard the mayor say there's 6 that are still not even 50% vaccinated. We are working in partnership with all kinds of community organizations, with the Chicagoland Vaccine Partnership, et cetera. And we continue to do events. We're going out, we were at Fiesta del Sol, we were at Lala, we were, all over signing people up for at-home vaccination and then bringing vaccine to settings where we know people are excited to get it. Swaparama is today. Right. It's been a great event for us week after week. People come, they're happy to get vaccinated on the spot while they're going about their business. And so we still are doing a lot of outreach. And if people have ideas for other ways to get people, signed up for vaccine or work on those barriers, we're always interested to hear about them. I think related to mandates, certainly there has been a lot of focus on this, and I think appropriately over the last few weeks to months. We have seen companies, we have seen healthcare settings, we have seen some municipalities, we have seen some states, we have seen the federal government all make that decision, but different flavors of this, right? So whether it's Google just did a mandate really with medical and religious exemptions, but without sort of a testing option. We've seen some other places think about testing options. There are conversations that we are having about that here, but there are a lot of stakeholders involved and a lot of decisions related to operational, what that would even look like. So we have not made a decision at this point, and we certainly continue to, continue to discuss this.
Thank you very much.
Yep.
Judy Wang, WGN.
We've spoken to a lot of Lala fans in Grant Park, vaccinated and not vaccinated. You've seen the pictures, very few people wearing masks. We counted a handful at some point. People flooding CTA stations on their way to Lala, no masks on. Are you still confident, given what the CDC is saying, the data is suggesting? Are you still confident that it was not a mistake or that you decided to go ahead and go with Lala still?
Well, look, again, context and facts really matter here. 90% of the people that are in Lala are vaccinated. We spent a tremendous amount of time working in partnership with the Lala folks to make sure that we incentivize people to get vaccinated. And also, folks, let's not forget, since we fully opened up in June of this year, we've had millions of people attend outdoor events. Let's talk about the number of people, 40,000 max at Wrigley, and then another at guaranteed rate. We've had big festivals all across the city all summer long. I understand the fascination with Lala, but the fact is, in this city, because of the efforts that we've made to get people vaccinated, we've been able to open, but do it with care because of the vaccinations. So I feel very good about what we've done. Obviously, we'll know a little bit more in a week to 10 days. But we have to keep pushing the fact that the unvaccinated are the people that are at risk. The unvaccinated are the people who are putting themselves at risk of sickness, hospitalization, and certainly death. And they're not only putting themselves at risk, they're putting their family members at risk. So getting people vaccinated is critically important. And let me just put a little finer point on the question that Aaron asked. We are not just focused on the Protect Chicago Plus neighborhoods. We are all over the city. We follow the data. Clearly, as you've seen today, and as you've seen really from day one that this virus came to our city, we're focused on those areas where there's lowest uptick, but we are not only focused on those 13 Chicago Plus neighborhoods. We've made great progress, by the way, by being intentional in those neighborhoods, by putting equity at the forefront of our vaccine distribution strategy. But we follow the data, and the data tells us that those 6 neighborhoods that I identified earlier are the ones we've really got to make sure that we give even more emphasis to, because we're not seeing the kind of uptick that we need. If we can bring those neighborhoods up and we continue to see the uptick in other neighborhoods across the city, we're going to continue, I think, to be well positioned to recover and fight back this latest little mini surge with the Delta variant.
Mayor, Marissa Pearl, CBS 2.
Okay.
2 questions for Dr. Arwady.
Oh, one other thing, I'm sorry, I forgot to ask. I forgot to answer. CTA. Do not get on public transportation in the city without a mask. Do not. And we are looking at conversations with the CTA to look at enforcement. I do not want people getting on public transportation, whether it's rail, whether it's bus, without wearing a mask. It's not wise. You're putting yourself at risk. You're putting everybody else at risk. What happens on a bus or train? That's an indoor environment. What have we said? Wear a mask inside. And that applies to CTA rail stations, buses, and rail cars. Wear a mask. And I hope that we don't have to get to a point where we're writing people tickets, but if we need to get the word out and to make sure that people are compliant, we absolutely will. But I want people on public transportation in this city coming in or going out to wear a mask, period. Why would we put anybody at risk, not the least of which is those CTA employees who've worked their tails off through this pandemic, through thick and thin, to make sure that people could get to their work, to their job, to leisure activities. They deserve our thanks, but really what they deserve is people wearing masks. So public transportation, put a mask on. Go ahead, Dr. Allison.
You briefly addressed the CDC study out of Massachusetts. I want to circle back to that again, because I think there's a lot of discussion and perhaps alarm from people who are fully vaccinated, who see the CDC is saying 74% of those infections were in people who were fully vaccinated. Tell us, what is your takeaway then? Does that not deserve some concern?
So lots of context here, and it did get a lot of attention, I think, before the CDC had formally released the data, frankly, and there were some assumptions and generalizations, I think that were made just in the way that the news got out a little bit. So what we see in Provincetown is, first of all, it is a pretty, it's a situation where you are in a highly vaccinated setting. And one of the reasons you hear us talking about the fact, 99.9% of the people who have been vaccinated have not gotten COVID is because the most important thing to measure is actually not the percentage of people who are diagnosed who get COVID, but the other way around, the number of people who are vaccinated and then get COVID or get hospitalized or die. And it's important to put that in perspective. Certainly in this outbreak, it was one of the situations where there was the ability to do some more lab testing, which is important. I think it may have gone a bit far in terms of assuming that what's called the CT value, which is an approximation of the amount of virus that's in somebody's nose, is a definite corollary for how contagious you may be, because in fact, it's not just your nose, it's your nose and your lungs. And so we know that data, we see that data. Partly because of that data, we've got the mask recommendation back. But what I don't want people to take away from that, because we have not seen this around the country, is that the vaccines are not working. And I think that was, unfortunately, just a conclusion that folks came to. If we were in a setting where 100% of people, or maybe not, 95% of people who were vaccinated, a huge number of the COVID cases would be in people who are vaccinated because 95% of the population is vaccinated. Does that make sense? I know it's a little bit confusing when we talk about it. But basically, this was a setting where a lot of people were coming to town, and we've seen the numbers, come back down, and again, not seeing the serious outcomes, really different than earlier outbreaks that we've seen. And even among those folks who got vaccinated, very rarely were they hospitalized, and no deaths.
So, Doctor, can you also just talk a little bit to what that PowerPoint deck was and what it wasn't?
Yeah, sure. So the mayor's just referencing, so there was an internal CDC PowerPoint deck that was, I think, leaked, I'm not entirely sure, on Thursday. It came out on Wednesday or Thursday, in the Washington Post initially. And I will tell you, I was actually fairly alarmed reading the media coverage of this before I had seen the actual PowerPoint. When I got a copy of the PowerPoint and looked at it, 95% of what was in there, we already know. And there actually it was helping put into context what do we know across different settings, and then sharing specifically some modeling that's been done. And then there were some words on the slide that I think people, it was not meant for public consumption necessarily, and people perhaps, understandably, look at the words on the slide and sort of report it as such. And so there was speculation, for example, might the Delta variant be more, make people sicker? I want to be really clear, that is not proven at this point, right? And it's one of the things that continues to be investigated, but the way that was leaked and then shared, I was way more worried reading the media coverage of it, frankly, than I was when I actually saw the data. And when I saw the data, the only really new piece of data was this thing about the CT values, this thing that showed that in this Provincetown outbreak, again, relatively, they tested 100 and something people, so this isn't 1,000, this isn't like an enormous study. You saw about the same level of virus in the nose, whereas previously with other variants, we had seen somewhat lower amounts of virus in the nose. But is that in and of itself something that makes you, that makes me hugely concerned about where we're going? No. What would make me hugely concerned about where we're going is if we really saw the vaccines not be protective, and especially not be protective against severe illness. What we're talking about here, where we are right now in Chicago is honestly like better than a typical flu season. And even during that surge in April, it's consistent with a bad flu season. And what we see is that people who are able to get vaccinated, just as we see people who get vaccinated against flu be much less likely to be hospitalized or die, we're seeing that same scenario. So we'll see we're going to keep seeing surges of COVID, right? I think as the winter comes on us, the fall and the winter, I would expect we'll see it coming back again, just like we've gotten used to having cold and flu season. I think we'll have cold, flu, and COVID season. But what we will see is folks who are not vaccinated largely having those severe outcomes. I've seen nothing that suggests otherwise, and I think we're in a good place as far as the recommendations of the vaccine plus the masking.
So we talk about groups of vaccinated people being together, and our recommendations right now are that if you're indoors, to wear a mask. Well, what if you're going into an establishment that only lets vaccinated people inside? Do you still need to mask up?
So if and we are starting to see that a little bit, I think. And certainly, when you are in a setting and you can know everybody is vaccinated, we have, the risk is very low in that setting. That said, I think we're just at the beginning of figuring out what this is going to look like. You've heard us say it's a recommendation at this point, sort of not a mandate. Certainly, I remain, I feel comfortable when I'm in a setting and I know everybody is vaccinated. But our recommendation remains right now that at indoor public places, everybody is masking, and that is the recommendation at the population level right now. Again, not forever, but for right now.
Thomas Shuba, sometimes.
Hey, Mayor, I know you keep going back to the vaccination rate of the festival goers this weekend. I saw some videos where, people at the gates are basically just waving these folks in. They're just holding up their vaccine cards. Is that enough scrutiny to make sure that these aren't fake or someone else's?
I heard about that, but I was at those gates too. On Thursday, I was at the gates again yesterday. So we've been very clear with the LALA folks. They have to have tight security. Dr. Arwady, I think, indicated that she went a little bit incognito, didn't have all of her information, looked a bit different, and they put her through the paces. So we feel comfortable that the protocols that are in place are solid. We know that they've turned away hundreds of people over the course of the event. And as I said, from the time that we fully opened up on June 11th, we've had literally millions of people gathering at large-scale events all across the city, ball games, festivals, and so forth. And we haven't seen these large outbreaks. And the difference here with LALA is that they required people to get in to either be vaccinated or to show a negative test, unlike what we've seen in other venues. So there are always going to be people that try to game the system, but I feel very comfortable that they have put together protocols that are working, and we've been spot testing. We haven't just told them, tell us the information. We have eyes on the process as well.
And one more for Dr. Arwady.
Sure.
You were talking about that CDC report that the Washington Post did the story about, and I think one of the alarming things to lay people like me was just the amount of viral load that people are carrying with the Delta. Is that concerning at all with people in such close confines with each other at the festival this weekend?
Yeah. So that viral load data is, that was part of the CDC's change to recommending masking, specifically, though, in communities with substantial and high transmission. I want to remind people of that, because when you, and we've just crossed into that substantial on Friday. It's why we made that recommendation. When rates remain low, your chance of being exposed to COVID actually remains low. That's actually the more important thing. As you see the number of cases rise, there's more possibility that you are potentially exposed to someone with COVID. And again, I would just say we are still learning about how those viral loads in the nose like how those correlate with the viral loads in the lungs, how those correlate with transmission. So certainly it's concerning when we're reading, it was a well-done study. I'm not saying it wasn't a well-done study at all, but how generalizable is that? What does it mean long-term? I do think we're still learning, and it's important to put it in the context. We absolutely followed, I went right ahead with that CDC guidance. We're going to better safe than sorry, put the mask on. But I do think we're still learning a little bit more about it. And it's mainly just because the Delta is more contagious. We've known it's been more contagious for a long time. And we're still learning, I think, is what I would say. But it's something that needs continued study, and that's one study that was important and needs to be replicated and redone in other spaces, and we may do some of that here as well.
That's a wrap, folks. Oh, sorry. Sorry. Got ahead of myself. Regina Waldron from NBC5.
All right, I guess, Mayor, if you could talk about this. Howard Brown Health released a statement late last week requesting that Market Days Pride Parade implement a series of more precautions, including capacity limits, mask requirements. They even pulled out of the festival and going to do everything virtually until they see, I guess, stricter precautions. Can you speak to that?
Well, I'm not going to speak for Howard Brown, but obviously, we want people to be careful. That's why we're here today. That's why we've been talking about things related to COVID-19 and protocols and protections that people can take on a regular basis. Certainly, if the organizers of those events want to step up what the protocols are, we stand with them. But as I said, the thing that I think I hope you take away from the discussion today, inside is different than outside. It always has been. Inside's different than outside. Outside, we know from study after study that the transmission is much less than inside. And the CDC study, and again, I'm going to play epidemiologist here a little bit, that was intended for an internal audience where they're talking to each other in a very different way than they would talk to the general public. And it's unfortunate that that internal document was leaked because it's created this whirlwind of hysteria that doesn't need to be there. Bottom line is this: get vaccinated. If you get vaccinated, you substantially reduce the risk to yourself, to your family, people in your network. I can't emphasize that enough. Get vaccinated. If we raise the number and the percentage of people vaccinated in the city, the risk goes down exponentially. We know that from the data. There's no dispute about that. Get vaccinated.
All right, my next question, Mayor, is the Biden administration is calling for local governments to pay $100 to people who are still not vaccinated. They say the money can come from those relief funds. Any prospect of us doing that down the line?
Well, we've done a lot of incentives to try to get people vaccinated.
Anything about $100?
So, well, let me just finish the point. We have done free tickets. We've done other kinds of incentives. We've done meals. We've done giveaways. We've done a significant amount, many of which value more than $100. We're at a point where the people who are unvaccinated, we've got to think about different ways to reach them, because those incentives are not enough, clearly. Because if they had been, then we'd see the rates in some of these difficult, in these DIPS codes that are below 50%, we'd see those rates rising. If it was just a simple question of giving out money. More needs to be done, and more, I think, is educating people about the risks that they face, disabusing them of the disinformation that's on social media, where we see people spinning up all kinds of fantasies about the virus, about the vaccine, and so forth. So we're going door to door. We've been going door to door for weeks. We're offering up information to help people get comfortable, as Dr. Green herself said, and I agree with this wholeheartedly. If you're on the fence, if you're undecided, find a medical provider that you trust. Go on the Chicago Department of Health, Public Health's website. Find the information for yourself. Talk to people who have been vaccinated and find out what their experience is like. But for God's sake, get vaccinated.
That's a wrap, folks. Thank you very much. Thank you, Mayor.
Thank you.